Hi, everybody. Thanks for joining us. This is session number 2 of our Navigating the COVID-19 Crisis. We're calling this session Working in the New Normal, with a focus on all the states slowly opening in slightly different phases. And that is the focus of this one, whereas the first one we did was more on where we were in the moment back in April. So what we put together is a panelist of senior leaders from our team here at the Granite Group. We have Bill Condren, our president and CEO, Chris Ploss, our chief operating officer, and Tracy Spangenberg, our chief people officer. And each one of those folks can talk to how we've handled everything here at the Granite Group since the pandemic started, and then we'll be available to answer questions that may be important to you regarding how both we've handled the pandemic and how we could potentially give you some guidance on any questions you may have, and we'll do everything we can to answer those. So without further ado, I wanted to turn it over, well, actually, before I turn it over to Bill, I wanted to go through a little bit of housekeeping about the way we're going to run the forum. Everybody will be muted, but there will be an opportunity to ask questions. All right, so you can either join by telephone or computer audio. If you have a question, you can raise your hand. Okay, just following the prompts there in that image. You can type your question in, or we could actually, if the audio works, and sometimes it can be a little, as you know, if you've probably done a few of these things, can be a little spotty. You can type your question in, and that will go to the organizers and the panelists, and we will be sure to answer it ASAP. And if you have any trouble hearing us, or if you have a question regarding, maybe not being able to see something, please let us know as well. All right, without further ado, I'm going to turn it over to Bill Condren, President and CEO of the Granite Group.
Thanks, Brad. First, hi, everybody. Thanks for being here. Thanks for making the time. We hope this is helpful. We're all navigating this, overused term, new normal, and trying to figure out how to continue to work in this environment. So we thought it may be helpful to tell you what we've been doing, what we've seen. To the extent that we have the experiences, we've been working, as many of you have, throughout this pandemic, and we work in multiple states with a broad and diverse group of individuals with different needs and so forth. So we thought it could be helpful. We hope it is. You'll hear from me, and I will open it up to Chris and Tracy. Chris to give you kind of the operational point of view and how we've been handling it on a branch by branch basis. Tracy's always was an expert in these areas. Now she's really become even more so for us, and can answer a lot of any HR related questions or help guide you into some of those where you can get the answers. And then we'll do Q&A throughout. So that's kind of the plan. Should be, as you know, with us, always pretty casual, open, and hopefully in some ways helpful. So much like I'm sure everybody on the call, this pandemic hit us flat-footed. We didn't experience or expect to see it coming. We responded immediately in the early March with a travel ban. I happened to be at a conference when this happened and put myself on a 14-day quarantine. That was kind of the first stage. Very early on, it was Tracy's idea. She suggested we get an email group going that we named the Virus Response Group at thegranitgroup.com. It was myself, Chris, Tracy, Kevin, who's my father, our chairman, and then Amir Rosenthal, who's our CFO, and got that out to our people. And I would say, a theme you'll hear throughout this from us is communication has been critical, and it's especially valuable in a time when there's not much of it and a lack of clarity. Just that we're all dealing with a lack of clarity. So opening that email chain gave our 585 team members a chance to talk to any of us directly. And in the early goings, we were flooded with questions. The one that resonated with me that I still remember early on, we had a team member reach out to us one evening and said, I just had my first baby and I can't get into the hospital to see my baby or my wife, and I'm worried about going to work tomorrow and contracting the virus and bringing it home. It was like, oh my God. We all of us who have children know that's a stressful enough time, not in a time of pandemic. So our response was go home, stay home, we'll pay you, and let's continue to get this figured out. We had an early case. Someone in one of our branches got tested positive when we weren't even, he didn't even know he was being tested for it. He thought he was being tested for the flu. He was positive. We put in kind of a rapid fire policy and procedure, shut the branch down, cleaned it, traced back to his, first day, went 14 days forward till we opened it back up again. I don't know if it's better to be lucky or good. We got feedback immediately from the state saying that we did everything right. The Department of Health told us we did everything right, handled it correctly. So that was good to see, but that was immediate. And this is all like March 20th-ish, so very early on in this. And then we continue to keep that response and that email chain open. We continue to get daily, today, people, what about this? So-and-so traveled this way. Someone thought they may be exposed. How do I handle it? Just very open and very kind of, one of the things we've been attempting to do is very transparent. The other thing we did since day one, I send an email every day to everybody saying, this is what's going on today. This is what we're doing, this is what we're trying, this is what is working, this is what isn't working. Sometimes it's a video, often it's an email, every day it's a message. And I think that's been, from what I've heard, pretty important. Again, communication and transparency is what we've really been trying to do. I know, I'm sure all of you on this call, many of you run your own businesses, and it can be difficult to make decisions to how to navigate in good times. It's exacerbated in times of crises. And you fall back on what you were as an organization and what you built. And if you built a good culture, which many of you have, that really guides you through the turbulent times. And I'm sure there were companies that didn't have that, and that's that much harder to get and manage through a time like this. So my message is we've been immediate and try to kind of immediate, rapid, constant communication, as much transparency as possible, even transparency in difficult things. Like, early on, we had to look at cuts and furloughs and so forth. And before we qualified for the PPP, which we ended up qualifying for, but didn't think we would initially because we thought we were too big. We had to make difficult decisions then, and we told people exactly what we were doing and why we were doing it, and continue to do that. And that's kind of what our commitment has been. And then that's always, but those were early crises. Now we've gotten kind of used to this and strangely kind of good at it. We recognize ourselves, and all of you, I'm sure, feel this way as well in some ways. We know what we're doing now. We've been working for 60 days in this new normal. So as companies come back, they don't know how to handle it, and they don't know how to set up distancing and set up masks and set up their own office space, or in our case, our branches and warehouse. And we've gotten pretty good at it. All of you, every customer in line, you've been great. You've understood and worked with our guys. I hope you see that we see that you're just trying to do your job and working in an environment like this. And so when you're in our branches, you're welcome. More than welcome. We want you there. We appreciate you there. You're our customer. We're not there without all of you. And I hope you've seen that and felt that from our people. And it's kind of settled in. Like Tracy reminds us daily to continue to be vigilant, which is helpful. Be smart, be safe. More than anything, if you are sick or showing symptoms, stay home. Social distancing, all the things you've read. But we've kind of been able to, and I'll hand it off to Chris now to kind of talk about some of the branch specifics, but we've learned how to operate in this new normal. And our branches our counter areas are set up a little different. Sneeze guards are now in all the locations in varying forms. Masks are worn when we can't keep distant. But generally, we've figured out how to operate in this environment. And that will kind of continue to marshal forward. And I think you guys, by and large, the customers figured this out really early on as well. And our industry has really continued to operate as an essential business. So now as others come online and struggle with a lot of questions, I feel we have some pretty good kind of knowledge already built in and muscle memory on how to handle this. So before I hand it off to Chris, Brad or Corbin, any questions pop in, or do you want to go right over to Chris?
We have not, we had one question come in.
Okay.
Oh, that's right. That's not, yep. No question.
Yeah, so just as you guys continue to please ask or raise hands, or however Brad instructed us to let us know. And then I'll hand it off to Chris to talk a little bit about how the branch has been set up, and then Tracy's expertise on state by state laws that we've been juggling. And we'll go from there and take some Q&A.
Okay. I think when we think about our branches, as Bill said, every location, at the Granite Group really set themselves up a little bit differently, because, every counter area that we have, is a little bit different than the other. Some of them are much bigger. Some of them, have a space, where customers weren't going to be in a really tight space. So what we did is we allowed our regional directors and we allowed our branch managers to essentially set up their branch to do business in a way that they felt safe, and that our customers would feel safe, coming to us. So many of you, if you were in our branches, you saw that, that we had tables set up in front of our counter to try and maintain a minimum of 6 feet, between, our counter person, or you coming in, to both to keep you safe and to keep our own people safe and feel comfortable. Some of our branches, were not comfortable having their branch open completely, so they went curbside. And some of you may have been familiar with that, where the doors you're essentially locked, or you could call in your order, or you could use our online store, to place your order. And when you said what time you would be coming along, the order was ready for you outside. But we felt that it was very important not to push our people to do anything that they were not comfortable with. And I think through anything that we've all learned, that was probably, one of the better decisions, that we've made, because, we consider ourselves, an entrepreneurial company, and we wanted our people to feel that way as well. So, okay. You guys have any questions on that, in terms of that?
Let's hold and go over to Tracy and see what she has to offer.
Okay.
Thanks, Chris.
Thanks, Chris. Yeah, I think that's important, that entrepreneurial spirit. It's one of our core values, and it's one of the things that I think really helped us here, because we saw some incredible ingenuity in how our different branches responded to keeping their people safe, and all of them are doing a great job at that. I think back to when this first started. I was traveling in early March. I returned home in early March, and I remember thinking while I was away, I was sort of like forgetting about the rest of the world and what was going on, and hearing about this virus that was just starting to come to the US, and came back. And I remember being involved in some virtual panel, and people joking that wasn't that a good idea, because it's, who wants to get together now? And then within days, the whole world changed. And I remember the date. It was March 11th, I think, is when we formed our virus group. We had a group of our TGG University. So TGG University is a group for emerging leaders. And I think that was our last actual full meeting that we had. And we asked the group at the very beginning, we said, so the facilitator, Bob Scoville, who is terrific. So he asked the group, and he said, how worried are you about coronavirus on a scale of 0 to 5? And almost everyone, except for one person, was a 0 or a 1. And they were only concerned about toilet paper and Tom Hanks. Those were the two things that came out then. No one could find toilet paper, and everyone was worried about Tom Hanks. He was the first celebrity to get the virus. So that was at the beginning of the day. And then throughout the course of the day, we were working on this, and Bill got the group together, and we set up the email, and we put out our first communication. And by the end of the day, I think they were all, 5s or 6s or 10s after that, because what we did was what Bill said. We put the travel ban in place. We laid out how we were going to communicate. And I think what's really critical in that theme of constant communication is we didn't stop. So we literally every single day push out some type of communication via email, often Bill on video. And even when it's something really difficult, it's important to be truthful and honest, and just echoing. And so we got a lot of feedback how important that was. So sometimes it's just reiterating things that we talked about. Sometimes it's sharing more, but that constant communication, you really can't over communicate in whatever way that works for your company, and recognizing a lot of you are a lot smaller than we are, but whatever way works for your company, just being as transparent, as open, as honest, and communicating as often as you can in a way that works for you and your company. And then, so that was a huge takeaway. We continue to do that. The other thing is really looking at the human side, and it's easy for someone in human resources to say that, but people respond really strangely to something that they've never dealt with before. And it looks like everything from anger to being really scared, to maybe some people miss work, to some people don't want to come into work. So it looks a little bit different for everyone. So we've really, and this is the kind of company we are anyway, but we've really had to respond with kindness. And there's a saying I like, fight anger with kindness, and deal with people who are scared and angry and upset and just worried. So that's been constant. It was constant in the beginning, but that's been a thread throughout. And we typically have our culture is really people over policy, but it's really, this has forced us to develop some things that we have to put in place. I mean, it's very strange to go somewhere and see people wearing masks, but that's the world that we live in. And the title of this is Working in the New Normal. I think it's really important to recognize that none of us are going to be returning to a world anytime soon that looks like it did 3 months ago. So as companies, we have to adapt. And I can get into the legal side a little bit as we go on, but it's been difficult for us, and we have an HR team, and for those of you who don't, trying to balance that. The local policies, like Portland, Maine has a mask ordinance, the state policies, the federal policies or guidance, and in a lot of cases it's not very clear. Like we lean on the CDC a lot for guidance, but it's guidance, it's not necessarily law. And OSHA has some standards, but it's tough to untangle that and to marry that all together. But it's important to do that. So we have, like Bill said, we have people who are wearing masks when they can't be socially distant, but we've done absolutely everything that we could to make sure that people are working regularly 6 feet apart. And
Exactly.
that's been a really good, yeah. So you've seen that, Chris, and you've been in most of our locations now.
Yeah, and I think to really to echo what you're saying, Tracy, and for everyone on this call, is that I would really encourage all of you to encourage your people to keep you informed of what's going on, whether they're on a new construction site, whether they're starting to work back in people's homes, what's going on in your company, because to be empathetic and to encourage them to help you come up with solutions that you've never had to deal with before, I think is a real important thing, and it's going to be really empowering for the people that work for you, and it's going to allow you to be a better company, for it, because a lot of times when I get out into the branches, our people in the branches who are the ones that are doing business, every single day. I'm not the one that's on the counter every day. And just like many of you aren't the ones that are out working in the field every day. So encourage them to come up with that communication so that it can help you deal with situations every day.
Yeah, I would echo all that. I think what you're hearing there is, this has all the makings of the financial concerns, but then you have the personal health concerns and the concerns for your loved ones that you're going home with at night, and that was really acute early on. It's become a little more a little less everyday 5-alarm fire feel, but it's still there, and that's why we very early on said we should have policies to keep people safe, but we shouldn't dictate policies that make them feel unsafe in the name of business. So that's why Chris spoke of the policy of you decide how to set your branch up to your level of comfort. We'd feel like jerks if we sat in our offices and said, oh yeah, open your counters, when they weren't comfortable. And over time, they all became comfortable, but not on day one, and we respected that. And those who were did it the right way and opened it up and figured out how to make it work. So that also goes with what Tracy said of like listening to them. If they're like, I don't feel comfortable coming in because I live with my grandmother and she's incredibly ill. We juggled that. We figured that out and figured a way to kind of listen to them to make that work. So I think it's kind of being that two-way communication and realizing they're on the front lines and they're going to give you the best information on how to handle it. Some of our best, like early on, about, I don't know, maybe Chris or Tracy, 3 weeks ago, Chris was up in Newport at our branch on the Canadian border and showed us took a photo of a guy who had used, one of our counter guys used PVC pipe and plexiglass to create a sneeze guard out of, like, besides the plexiglass, all branch stuff we had in the branch. And it was great. And that was like just local ingenuity. Early on, the first kind of use of those tables at the counter was in Lincoln, Rhode Island. And our manager's like, this is how I'm handling it. We're like, great, that works. So they're living it, right? They're living it more than the ones of us who are kind of managing it. So listening to them, I think, is critical. And that's just that two-way communication, I think, is really important. We started to get some of the questions, so
we have a question.
Go ahead.
We have a question from Mark Stevenson, sorry. Mark, I'm going to try and unmute you now, and you can ask your questions. Mark, can you hear us?
Hey, guys, gals.
Hey, Mark.
Hi, Mark.
So safety is important. We have been in homes at this point in production for about a month now. This is week 5 for us. We're back at full capacity. We're quickly running out of gloves and masks. Our clients are, as much as anything, just they're concerned about the perception and the safety. We want to, as well as our employees, we want to continue to have those things, but we're concerned about any kind of supply. What is the opportunity through you guys to ensure that we have personal protective equipment? In addition to that, face screens that can be used for cleaning certain kinds of equipment, air handlers, whatever. Back to you.
Okay, well, I'm going to hand that off to Tracy because she's been our resident expert. She's become, for a company that claims to be, in the logistics game, she's become our PPE procurement expert. But before I do, Mark, we have you to thank for this call. It was your feedback to Brian Miller to do something like this that got us thinking about it and caused this to happen. So if it goes well, it's a credit to you. If not, it's all on you, Mark. So
I will. I got big shoulders. I can take that. But thanks. I have a follow-up question to the supply of PPE, and that's also concern about just the manufacturing chain. We're big heat pump Mitsubishi dealers. I'm concerned. That factories won't be able to produce equipment in time, and what your forecast for that would be. So those are my 2 questions.
Great, thank you. And joking aside, thanks for giving us the idea to do something like this. We don't get to see customers as much as we used to, so to virtually do something like this is great. Tracy, why don't you start with the PPE and then Chris and I will tackle supply chain.
Yep. Yeah, and I think, Mark, in there, your question too was what do we have available? So as far as masks and equipment as well, but I can't speak to that as well, but I'll talk about what we've done on the other side. So pretty early on, we saw the need that we might need to be heading toward people wearing masks. So I think it was actually the day before the CDC guidance, we commissioned a local seamstress to make some masks. So that for us works for our folks who aren't necessarily really close face to face or going into customer homes. I think you need something a little bit more serious, a little bit more heavy duty. We were able to get some through our own supply chain, and I don't know for sure, but I think that that's starting to become, the masks are starting to become more available through our own supply chain. And we also were able to get them some PPE through the state. So we've had gloves, we've had a good supply of gloves and of masks throughout. So the state of New Hampshire issued masks. I would encourage you to ask the state if you haven't already. I know Connecticut is now handing out thermometers. So we've just continued to source whenever we could and wherever we could. We bought some things on Amazon. There's a local manufacturer that if we need them makes N95 masks. Now that I think healthcare, as they get toward set with all their ones that are required for healthcare, but the state has been a really good source, or the different states have been a good source for us. So if they're requiring wearing something, then they're going to have to point you in the right direction. But as far as our supply chain, I think that was that your question? Was it more about our supply chain or how to get them
Well, I think
externally?
it was
Or how,
also
for
Chris
himself.
has some information on how
Okay.
we can, so that's how we source. And then Chris Moore, I think Mark was also asking, will we sell, will we provide, will we have PPE?
Right.
And I know
Yep.
we've had some already. So why don't you jump in there?
Yeah. Well, so as far as, you know, the PPE stuff, I think that probably what we could do, we could probably come up with a list of some of the suppliers. I would think, Tracy, you know, with Abby, of you know, of where we've been able to source masks and where we've been able to source plexiglass face shields, you know, things like that. So we can certainly come up with a list, and, you know, whether you want to email me, anyone out there at cplos@thegranitegroup.com, or you know, or to Tracy and I, tsponenberg at thegranitegroup.com, we can provide that list, you know, with the phone numbers that we had for anything, you know, PPE, if you feel like you're struggling to get anything for your own people. With regard to supply chain for product, you know, right now, honestly, we've been, the manufacturers that we deal with right now have been pretty solid. You know, we had some issues out there where manufacturers were sourcing products from Mexico, and that became, you know, an issue in some cases. But Mexico has allowed some of those factories to open up that make parts for some of our major manufacturers, and that supply chain is loosening up right now. As far as commodity type product goes, we haven't seen anything so far yet at this point that's really giving us a lot of pause. And I don't know if you want to add to that, Billy. So.
I would add, you know, as far as Asia, the Chinese market specifically, who knows how this will, you know, dictate, you know, reshoring or the end of offshoring. That's not really our decision to make as a distributor. But we have seen the products that we do get that are manufactured in China, those haven't skipped a beat because there was a lull between when they were down and then our demand was down. So haven't seen it there. We have a weekly call with our entire leadership team, and Brian Roller, who oversees our purchasing and procurement, he said it's eerily silent from the manufacturer, in so much as that they're like business as usual. Things are coming along, things are moving. We had a state water heater plant in Juarez, Mexico, hit an issue. But very exceptional, and then caught up very quickly. So far, because all of our manufacturers were considered essential as well, and I think pretty quickly tried to put in social distancing in their plants to keep them running. We really haven't seen anything, Mark. If states open up full bore and we're sprinting in, you know, the middle of July, could that change? Yes, but from what we see now and from what we forecast now, we're okay. And from every wholesale distributor I've spoken to around the country, and I've spoken to a lot of them as this has happened, and a ton of our manufacturing partners, they really don't see any supply chain issues as of right now. If this has taught us anything, things change and change quickly, but so far, so good on the supply chain front. So Corbin and Brad have more questions come in?
We have some more.
Yep. So we have some more questions. So Warren would like to know, how have you set up social distancing at your distribution facility, picking, shipping, break rooms, etc.? What will change as the summer progresses? Great.
You want to take that, Chris?
Yeah.
Yeah, I'll take that one. Okay. So Warren, I'm assuming that you're talking about our central distribution facility in Londonderry, New Hampshire. So I have conversations with Mike Wayne, who is our VP of Logistics, who runs our distribution center every day. And it is, you know, obviously it is our largest facility from a square footage perspective. And the team there is, they get it drilled into them, you know, on a very regular basis from Mike Wayne about keeping their distance from each other. And really the size of the aisles and everything that we have in our distribution center allows our people to remain, you know, a minimum of 6 feet away, you know, pretty consistently. Mike and I were having a conversation today, you know, for example, if they get a large box, or what Mike would call, say, a gaylord of Kohler faucets, you know, that are in there, and we could have 3 of our associates, you know, reaching into that same big container at one time. Mike is asking them, and obviously, at this point that they wear a mask when they're like that, because they could easily be 15 to 18 inches away from each other as they're putting their arms and their head, down into a situation, like that. In terms, of our break rooms, really the way, that our break rooms, work, there's very rarely multiple people in one room sitting at a table, or anything in our distribution center. It could happen, but for the most part, as the weather gets good, they're going outside, or as Mike was saying today, like a lot of the guys will just go out and they'll just eat their lunch, or they'll have a snack. They'll go sit in their car, while they're there. So it's essentially, communicated with the supervisors there, to just have our people, be smart, in that, and that everyone is just trying to, to stay at a distance. I know that when I go to visit branches, or I go to visit the distribution center, I find myself, when I'm talking to people, I'm standing 8 feet away from someone, when I'm having that conversation. And I think for the most part, our people are, are feeling that same thing. Yeah. So I hope that covers it for you.
I talked to Mike earlier today too, and I think that the key, they had a socially distanced, or they were about to have a socially distanced stand-up meeting, and that enforcement of wearing masks if they can't be 6 feet apart is everywhere across our company, and the staggered shifts that they have at the distribution center really helps as well. But I think we, like Bill said, we've been working throughout, so we had protocols early on, and one of the things we didn't talk about, one of the things that really helps in a distribution setting is we have had an early protocol before we had to have a protocol of keeping people out if they were sick in any way, shape, or form. So if somebody sneezes within a mile of our building, we don't want them near there. And so that's really helped us keep people away who might be contagious with something, whether it be COVID or not. And so that's really critical in a distribution environment where you could end up closer than 6 feet apart at times.
So we have another question from Ryan, who wants to know, as we start to get into the air conditioning season at the end of this week and moving forward, is Granite Group doing anything creative for technicians who will handle air filters and dealing with air quality products?
Ryan, that's a good question. And would it be okay on that one if I got back to you? Because we have not, done something like that. But I'm going to have a conversation with Mike Kelly, who is our Senior Vice President of Business Development, and is really HVAC falls under him. So I will get that question answered to see if he's thought of anything like that, and I will get back to you offline if that's okay.
Yeah, and also I would say, Ryan, if you have any ideas, we're all ears. We think our best ideas come from you guys and from our people. So if you've got something, or you've seen something, or think of something when you do connect with Chris, we'd love to use it. I think, a big theme in this, oft painfully overused term, new normal, is I think people just appreciate that you're trying. And I think, Mark mentioned that the PPE in the homes, people want to see you doing that. And, they're looking to us to try to stay distant. They're looking for us, even on the sales side, to come up with creative ways to try to service them and, give them some incentives. It's across the board here. Our definition of what is okay now has been it's been so reduced in this time, right? That a thing like this, because we can't see you, is now these days considered a good way to connect and share information. We do our annual meeting every year where we bring, any of our hundreds of our associates together to celebrate, to go over sales numbers, to share info, to give awards, and to give service awards where, 5, 10, 15, 20 and on up. And just last Thursday, we did it on a Zoom call, and we had 326 people on a Zoom call for our annual meeting. It was Tracy's idea. We sent everyone who came in advance a Domino's gift card so they could be at home, have pizza. We did it at 5:30 at night, and celebrated the service awards. And I think we gave out service awards for 85 people. One guy got a 45-year service award, which is just awesome. And at the end, when we asked people what you think, they're like, thanks for trying. I was like, was it as good as when we get together? No, but it's better than nothing, and A for effort. And I think that kind of reasonable people and our reasonable customers, and certainly your reasonable customers, all appreciate that now that you're just trying and you're trying to figure out how to operate and kind of communicate in the new normal and the restrictions that we have to live on for now and for the foreseeable future. Coburn and Brad, what's next?
So we had a comment from Chris Chagnon, who wanted to let people know that they had contacted the National Guard and received boxes of masks for free. So we want to thank him for providing that feedback.
Was that New Hampshire? What's in a New Hampshire location, or is this just like a national number? I'm curious, because I know the state of New Hampshire has them, but if Chris is still around, if you could just message that to us, that would be great.
I will shoot him a note on that. Hold on a second.
That's good
Chris,
to know,
can you hear
though.
us?
Hey guys.
Hi.
Yeah, so we coordinated with the National Guard. I think they had a facility outside of the Manchester DMV.
Okay.
We ended up getting,
Oh, that was the state. Yep, the state
Yeah.
mask.
yes, we got
Yes.
6 or 8 boxes, so.
No, that's awesome. Yeah, if folks don't know about that and who are in New Hampshire, you go to the state website, which I can tell you in a minute, and you can order them, and that's right, it's distributed by the National Guard, and they're free. And we got I think 2,500 last week.
Good place to start.
Yep.
Coburn and Brad, are there more questions?
Yep. We have a question from Mike. He wants to know what works best for signage inside of the buildings to make people aware of the COVID policies.
Sure. You want to take that, Chris? You've kind of overseen that.
Sure. Well, we've been able to, with a lot of Brad Dupui's help, this is one thing I think that we have, that we've tried to be consistent with signage as much as we've allowed, our branches to be entrepreneurial and to be able to handle how they wanted to do business in their locations. We did feel that it was very important for us to have very, standard, signage, across our company. So basically what we did, for signage, for the most part is that, we had them, on the doors that were outside. We have, in our Ultimate Bass stores, we have signage when we, when people walk through the door, asking them, to wear masks, and we ask them to, to sanitize their hands because they could potentially be touching, product in our showrooms and, and faucets. And we're certainly making sure that our Ultimate Bass sales associates are wearing masks, but that's communicated to them, right when they, right when they walk through the door. We've created, certainly, documents even for our truck drivers to have, in our trucks, so that if you, as our customers, are asking us what our policy is, in terms of how we're dealing, with each individual state's requirements for our people, that's there for them to be able to present to you, at any time. So I don't know if you want to add anything more to that, Tracy or Brad. You've created a lot of those signs. So.
Yeah, so we created, in addition to the policy, we have this one pager. So in New Hampshire and in other states, you're required to, ensure that your employees are coming to work healthy. And so we have a self-check monitoring process and a monitoring process in our branches as well. And that's a one pager that includes that and mask guidance, so that if our drivers are out somewhere and someone needs to know the policy, that they can explain that to them. So that's been, I think, really helpful. And it changes. That's the hard part of this. Things change all the time. Guidance changes, things change. Not as much now as it used to, but it used to be on what it seemed like an hourly basis. But we're doing the best we can to try to keep up with it. And it's a challenge, but we can. I wanted to share that the mask order form, for those who don't know, it's newhampshire.gov. And if you click on the COVID information, you'll see a button that says Masks for Businesses request form. And if you haven't done that, you can get those.
Yeah, the thing I would just add to that is, you know, requirements and guidelines are two very different terms.
Right.
They used interchangeably, and you got to be careful with that, because like early on in the state of New Hampshire, it was like, it looked like the governor was saying, if you want to come back to work, and meanwhile, we were all working at this point, you have to do temperature checks every morning. And then, you know, Tracy deserves a credit here. She tapped into her network of other HR professionals, and everyone's trying to interpret this and see this, and what was a requirement became a guideline. And so the goalpost move, any of you who have been experiencing with the PPP see that still moves daily. And I don't mean that accusatorily at all. I think every government agency, every governor, every leader's trying to figure this out, and trying to keep people safe on the fly here. But requirements and guidelines have very different very different impact on our businesses. And I would just say that what you first see and read that looks like it could be a requirement, and it may be, but some of them end up being guidelines, and you can live within those guidelines by being, I don't want to insinuate, you know, by skirting them, but by just looking at them as guidelines on how they expect you to operate, as opposed to requirements, which are much more kind of rules.
Right. Right, and often these things are issued in a response to something, and like, for example, if you issue a guideline on temperature checks and then no one can get thermometers, it's really hard to enforce that. So there's almost always some type of, if this isn't feasible, then. So our process has been, here are the things that you need to check for every day before you leave for work. Take your temperature, look at this. Are you feeling this? Are you feeling that? Are you feeling you know, or do you have a cough? Are you sneezing, etc.? And making sure that people don't even come through the door if they're ill. And we've been doing that since day one. And we go through that with our managers repeatedly, probably annoyingly, but continue to drill that home as we get, you know, months into this thing. We still drill that home. And I think we've done a good job at keeping people away who could have something, because I'm sure that early on when testing wasn't around, we probably had people who were ill with coronavirus and didn't know it. We probably all did.
Yeah, and that's been that, you know, to echo that has been, you know, really, you know, drilled into everyone. And, you know, I had heard one of our regional directors saying that I've asked everyone to put it on their bathroom mirror in front of them every day before when they're brushing their teeth, so that they can, you know, see that, you know, are you feeling ill, you know, anything, you know, that's like that. Because in the past, before all this came, you know, if someone had a little cold, you know, and you were coughing or this and that, you came to work because you trudged through it, because, you know, you didn't want to let anything get you down. And the problem is now with this, everyone needs to be thinking about not themselves, and that they have to be thinking about everyone else. And that's the thing I think that I think our people have done, you know, really, really well, is that they're looking out for each other. And I think if you create an environment like that where people are looking out for each other, by not coming in today is actually, in someone else having to do more work, it's actually better than had they come in. And that's really important. So.
Yeah, it's been changed in our cultural mindset. It used to be, you know, the tougher guys came in and toughed it out, and now it's the smarter people stay home and validate before they come in, for everyone's benefit. And also, someone asked early on, and we didn't address it, about how we see the, you know, the end of the summer and the fall, and, you know, there's all this discussion about second waves, and understanding that no one on this call, and I'm not sure many people at all, know any more than anyone else, quite frankly, of what this all shakes out. But my view, or our view, is, you know, we're so much smarter now than we were just 60 days ago about how to interact and how to be smart and how to be careful. And I joke, but I say, if I'm out in public and I see a guy sneeze, I'm going to have him arrested, right? I mean, we're like so vigilant and careful. So I think that will not forget what may happen with vaccine or treatment or what have you, which would be kind of game changing. But in lieu of that, I think we're going to continue, if we remain smart and vigilant, if we remain, you know, practicing these versions of these things that have got us to this point and flattening curves and so forth. I think we'll continue to be that throughout, which would mitigate a second wave unless it mutates or we don't follow these things. So that actually makes me encouraged for what could happen, and that we may be moving into a new normal that we can survive in. And a lot of those freedoms that we took for granted, but not all of them are coming back. I don't think you and me and anyone on the call will be having a beer at Fenway Park this summer, but in this new normal, if they're playing, we could maybe meet for a socially distant beer somewhere, and that would be okay. So
Yeah.
I think let's settle into this new normal and
Have
that's
a
not
Zoom
the
beer. So.
Yeah, Zoom beer. We've all had plenty of those. A Zoom happy hour. Let's see.
There's a question from Sean too. So.
What's that?
So we have
There's a question from Sean. So there's a few questions. So.
Great.
Yeah, there's a couple of questions. Tracy, I think you kind of covered this, but what should we do if an employee starts to feel ill? And then, tied into that, what do you do if somebody is afraid to come to work? That's kind of a,
Yep. If somebody feels ill while they're at work, you need to immediately isolate them. So isolate them from other people, stay 6 feet apart, and then you're going to want to send them home. We generally recommend, and it depends on what it is. We've had cases of what were likely food poisoning and people came back pretty quickly. If anybody has any of the COVID symptoms of fever, respiratory issues, muscle aches, etc., we've kept them out for 72 hours following when the symptoms cease. So that isolation immediately is really important. Sanitation, if somebody's touching all kinds of things, hopefully you're doing that anyway, but that's really critical too. And then following up with them, and you can't necessarily require, you may be able to require someone to see their doctor, but we do ask people to do that. And then make sure that
we encourage them.
Okay.
So.
Yep. We highly encourage them. And then somebody's afraid to go to work, and that happens. There, for all kinds of reasons, people respond differently. And there's the human side, and then there's the legal side. Can you force someone to go to work? Yes, I mean, you can, but you have to think of how you want to handle it. And there are ways people can claim unemployment. Unemployment is certainly opened wide up now. And then there are people who are just scared. So that communication is really important. And we've had people that were in that situation, and by continually communicating and giving them time they need, finding out what they need, we were able to get those folks back to work when they felt comfortable. And sometimes that takes a little bit of time. So some companies may cut someone loose, and you may have justification to do that, and that's not something we would do.
There's one question too that, I'm sorry, go ahead, Cope.
I was just going to say, in the
one
interest
comment.
of time, we've got 10 minutes left, right? So a little less than that. So why don't we maybe take 1 or 2 more, and then we'll wrap up to make sure we respect everybody's time.
Sure. So we have one comment. Eileen Lampman wants to let everybody know that they received a couple hundred cloth masks from FEMA that they ordered through the Vermont Fuel Dealers Association. So thank you for that information. And then Ellie wants to know, how do you deal with staff that suffers from seasonal allergies?
This is the hardest thing out of this whole pandemic. Every time I sneeze, I'm like, it's not coronavirus. It's not coronavirus. So particularly the state of New Hampshire, this is difficult. So they came out with respiratory symptoms, including runny nose. So that is very telltale for seasonal allergies as well. We have, certainly we've had that. If we have people who have known allergies and they talk to their physician, which most people do regularly, we don't require any kind of note, and we trust our people, but we make sure that they're, hopefully taking some Claritin or taking something, but that they're not actively coughing or sneezing all over the place. So if somebody is repeatedly coughing and nothing's working, we don't necessarily want them around. We haven't had that, to my knowledge, with people with seasonal allergies to that effect, but we do also have people wearing masks. So if we do have someone with the occasional cough or sneeze due to allergies, that mask will help. But the regulations make that really, 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 really challenging. And you can't keep people home who have seasonal allergies, really. So we just have to make sure that they are actually seasonal allergies. And I'm one of those people myself, so that's a tough line. I thought I had coronavirus like 6 times over the past couple months. I didn't, but just bad allergies. Yeah, no, I'm good.
Yeah, all right. Corbin and Brad, is there anything else? Or should we wrap up?
That's all the questions we have from the audience.
Awesome. Okay, good. Thanks everybody for making the time. Hopefully this was of value to you. Mark, credit to you. This seemed to go well, so thanks for the idea. You know, joking aside, we always like to talk with you guys, and to the extent that we've had anything, you know, being through work and having different states, having some information that's helpful to you, we're happy to share it. And I think you know this with all of us on the call and anybody at the Granite Group. If something wasn't covered or you want to talk more or you have some other questions, call, email, text, get in touch with us. We're happy to, we're kind of an open book because we're all trying to figure this out together. So please reach out. Thanks for all you're doing for us. We appreciate it. Hope to see you all socially distant very soon as we get out and about and kind of settle in here to the new normal. Stay safe, and more than anything, thanks for all you do for the Granite Group. It's very much appreciated. Take care. Thanks, everybody.
Thanks, everyone.
Bye.
Bye.